What if artificial intelligence could serve as a second set of eyes with your doctor, operating as kind of a second opinion?
To give you an idea,
we visited Dr. Irene Wong in her research lab to see it in action.
There are more than 400 MRI slices.
She's the research director of the Epilepsy Center at the Cleveland Clinic, where AI is already making a difference. Dr. Wong can team up with an AI system that has learned from a network of past epilepsy cases. The AI can then zoom in on an MRI scan to highlight a probability map for doctors to investigate further.
The more yellow or whitish, the harder it is. It pinpoints you to the area of the brain that calls for your attention. And that is the lesion that causes seizures.
This technological edge improving lives of patients like 34-year-old Ryan Millinger, who was diagnosed with epilepsy at 4 years old.
It was never fully controlled, and the medication was kind of an ongoing adjustment.
Doctors thought the lesion causing his epilepsy was too close to a part of his brain that processes his ability to speak. They decided not to take the risk with surgery. 8 years later, though, when the AI tech came on the scene, it found there was actually a safe way for doctors to perform the surgery.
That was such a life-changing experience for me. If they didn't have that, I'd probably, we wouldn't be having this conversation. As long as, people kind of advance in a safe manner, I don't see why it couldn't be an advantage.
75% of healthcare providers expect widespread AI adoption in the industry in the next 3 years, even as only about 40% have reviewed or plan to review regulatory guidance, according to Berkeley Research Group.
And we talked about...
That's why medical systems like the Cleveland Clinic are hiring up new AI executives like Ben Shashahani.
It is my first job in healthcare.
With a PhD and experience with machine learning at Google, Yahoo, and SiriusXM, the new chief AI officer at the leading medical center hopes his background in tech can cross over to assist tech's invasion into medicine.
We want to be, in the forefront of applications of artificial intelligence and technology in healthcare.
It's not just in Cleveland. Hospitals in Washington, D.C., Phoenix, San Diego, and San Francisco are hiring AI executives, all with the goal to merge new technology into personal health to create a better patient and doctor experience.
The doctors are always in the loop. Right, so the AI can process all this information. It can come back almost like a second opinion, right? You have your kind of a co-pilot that's sitting next to you, listening to the patient.
While artificial intelligence continues to take on new roles in the doctor's office, analyzing data and transcribing doctor-patient interactions, Shashahani's job is to make sure that implementation improves healthcare without compromising personal data, ethics, or safety.
Machine learning and AI systems are trained on data, right? And whatever the biases is in data is going to actually turn into bias of that system, right? And so it's super important for us to make sure that the bias is not harming the patient and is not having unfair and unethical impact.
If the AI, the machine learning, is wrong, who's then liable? Is that on the doctor?
I think that's an area that is yet to be decided. It shows you that, the technology, the pace of improvement is much faster than the speed that our policies have moved. There is potential for harm.
A fine line the healthcare system continues to walk for the sake of medical innovation.
Fascinating look at that. Maura Barrett joins us now. So the executive in your piece talks about the risks of AI picking up biases in data and then implementing them, right? So can you give us some examples of what that could look like and how they would essentially fix that?
Yeah, Tom, the root issue here is the fact that so much bias already exists in medical diagnoses as it already happens with medical human doctors. And so basically AI is learning from the data that humans provide them. And so if machine learning AI is being fed white male patient data, then they're not going to be able to diagnose or help in cases that evolve around women or people of color, and those people get overlooked. And so the experts that I spoke to really emphasize that the patient data needs to be as diverse as the patients that doctors see, and that diversity needs to include race, gender, and socioeconomic status, for example.
And in your piece, you make one thing clear, that as of right now, AI is only being used to give doctors a second opinion. Could we see its role expanded in the future where it's relied on more heavily?
Right. So right now it's existing kind of as a partner or an assistant, especially with those listening devices, right, that is making doctors' lives so much easier, where the AI is taking notes to the doctor and then sending highlights to the patients. And so that makes the doctor more present. What a lot of these experts are researching right now is whether or not there's developments that are possible with AI that can make remote access or virtual care possible for personalized medicine. There's also a lot of research being done around predictive technology. So where AI could look at someone's medical history or their current conditions and say, hey, this is your percentage chance of, say, getting cancer or diabetes, which means doctors can pay more attention for early diagnosis and treatment. But what I will say is no expert, nobody that I talked to ever mentioned AI ever replacing doctors. So that's the key thing, Tom.
Okay. Maura Barrett for us tonight. We thank you for the.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.